Today we have a very important topic to discuss, breast cancer. And we'll dive more into the breast cancer surgeries. And I'm Dr. Joshua Delito, a family physician with interest in cancer prevention and also public health. Welcome to Wellness Health Services Health Talks. So today I'm privileged to have Dr. Iram, and Dr. Iram will introduce herself. He's a breast surgeon.
Yes, thank you so much, Dr. Delito. So I am Dr. Iram Shabir and I'm a breast oncoplastic surgeon.
Yeah, so Dr. Iram, if you don't mind, would you tell us a bit about your profession, your work, what you have been doing?
Okay. So Dr. Delito, firstly I think I'm a general surgeon. And then I later on went ahead and specialized in breast surgery. So now I'm a breast oncoplastic surgeon. So I deal mostly with breast cancers and other benign breast conditions. And we try to see how we can remove the tumors from the patient's breast after treating them through chemotherapy or radiation therapy, and we try our best to reconstruct the breast in such a way that the women don't end up having flat chests like they used to have traditionally.
Okay, thank you very much, Dr. Iram. The people of this country, recently there is a big concern that the cases of cancer are rising, and there are concerns about what we can do to prevent breast cancer. Possibly you can tell us about what has been your experiences about the burden of breast diseases. What are some of the, I know you have mentioned some of the problems, and then what is the burden of breast cancer, and what are some of the measures that our ladies can take to prevent breast cancer. Not to forget us also that men also get affected by breast cancer.
Of course, yes. So yes, it's true that breast cancer occurs around 99% of our patients are women, but around 1 to 1.5% of breast cancer patients are actually men. So men can get breast cancer just like a woman can get breast cancer because they have breast tissue in them. So in terms of the risk factors that predispose a lady to breast cancer or even a man, so hereditary, that is positive history of breast cancer in the family, that plays an important role. So if you have either history of breast cancer in your family or other tumors which are associated with breast cancer, for example ovarian cancers, pancreatic cancers, if the males in your family have prostate cancers, these are some of the other tumors that can be related to breast cancer. So we take these women a bit more seriously because they are high-risk women. Also, the genetics of a lady plays a big role. There are certain genes that predispose a woman to getting certain types of breast cancers. And well, there are different types of genes. If I mention some of them, there's BRCA1, BRCA2, P53 genes, but there is that aspect of genetic mutations. Then I think apart from the hereditary and the genetic part, the biggest part of things that we can modify as a community to prevent cancer and even breast cancer is our lifestyle. I think lifestyle plays a very important role. So what we eat is very important. The same things that we keep hearing every day, we need to eat a lot of healthy food, fruits, vegetables, and also we need to make sure that we have a lifestyle that is not sedentary, because obesity has been shown to be a major risk factor for cancer in general and for breast cancer especially. And when we attend most of these conferences, there is a whole pathogenesis pathway that has been shown medically through research that tells us how obesity and excess fat in our body predisposes us to get breast cancer. So really I think what we need to know among the risk factors is that a sedentary lifestyle is not good for us. We need to control the kind of food we take in, and we need to exercise. If not on a regular basis, surely at least once or twice in a week, we should expose ourselves and make sure that we are not overweight and obese. Then of course there is intake of excessive alcohol, there is intake of, smoking is also a risk factor for breast cancer. So most of these are modifiable risk factors, and if we only are disciplined enough to control them, then I think we can bring down the burden of breast cancer that we have.
Yeah, thank you very much, Dr. Iram, for that very well elaborated explanation of some of the risks. There are some screening procedures that women can take on themselves that would help identify breast cancer, possibly before the cancer is out of the breast. I don't know whether you can highlight some of these, and so that we let our audience know some of the screening aspects.
Yes. So, well, I think the best way of screening is for a woman to be able to do a self-breast examination. That means that every month a woman should stand in front of the mirror and see how she can examine her breast. And when she's doing that, she needs to place her hand, maybe she can place it above her head like this, so that this breast tissue gets stretched up. And then she approaches the breast quadrant by quadrant. So it's a circle kind of thing, and we can divide it into 4 quadrants. And she's supposed to go just gently palpate each and every quadrant of her breast and see if she can feel any lump. That is good enough screening for a lady, maybe above 40 years of age, when the risk of breast cancer is high. But there are other medical tests that we can do. We can do mammography, we can do ultrasound, we can do MRIs. So there's a lot we can do on screening. Now, when it comes to medical screening, there's different school of thought. There are those doctors who feel that women should be predisposed to screening routinely, so that a woman is told that every year you have to go and do a mammogram of your breast. And there's that school of thought where surgeons feel like, no, it's not really necessary unless you're a high-risk patient. And by high-risk patient, I mean the women we've talked about, the women who have hereditary or genetic mutation in their family, who have a slightly higher risk of getting breast cancer. So I'm of a latter school of thought, because I don't believe in exposing patients to mammography every year unless they are high-risk patients. So I would recommend that at least a woman should be able to do self-breast examination, and if she suspects something has changed in her breast, then she should approach the hospital and see how she can be helped.
Thank you very much, Dr. Ilam. For our viewers, if you check, there is a video that I've talked more about the breast examination, how you can do it, and you can check on that. You'll get more tips on how you can do self-breast exam. Now, Dr. Ilam, possibly you can tell us of some of the surgeries that are available for those who have lumps that are suspicious, what they need to do, and what are the options that the women have when they present to you.
Okay, thanks. So yes, so before what we used to do is when we see a woman with breast cancer, then she was doomed to have a mastectomy, that is removal of her breast. But now we do less and less invasive procedures, simply because our medical treatment has improved so much. So the chemo drugs that we give them is able to shrink the tumor so nicely for us that we are able to do more and more breast conserving surgeries, which means we are able to remove only the tumor or only the lump from the patient's breast, and the rest of the breast tissue we are able to do oncoplastic type of resection, so that we can try and give them their shape as much as possible, so that sometimes we hardly know that we have removed a breast lump from the patient's breast. So yes, we can either do a mastectomy if the tumor is too advanced and we can't save the breast, or we can do breast oncoplastic surgery, breast conserving surgery, where we remove only the tumor and leave the rest of the breast tissue and reconstruct it.
Oh, thank you very much. I'm sure our viewers will be happy to hear this, that there are various types of surgery. You don't have to lose your breast. If you come on time, the lump is identified, and then you can have specifically the surgery to remove that specific tumor. Possibly you can talk about the reconstructive surgery that is available for women who have undergone mastectomy or lumpectomy, and what is there for them.
Okay. Yes, so well, it's good news now for us as breast surgeons, because it's very fulfilling for us when we are able to reconstruct the woman's breast and not just leave them all flat-chested as we used to do before. So when we remove, if for some reason the patient has to undergo mastectomy and we have to remove the breast for her, then there are different ways of reconstructing that breast. We can either put expanders and then later on put implants for her. That means we put something under the skin. An expander is like, it's kind of like a balloon that we can put under the skin, and then we keep inflating it in small amounts until the breast size is adequate. And then later on we take her back to theatre and we remove that expander, and we are able to put a permanent implant for her, which maintains the shape of her breast. That's what we can do if we are doing a mastectomy. But if we have done a breast conserving surgery for her, then we, as breast surgeons, we're able to do something we call a level 1 oncoplastic surgery. So that we do the surgery in such a way that we have enough breast tissue to kind of replace or displace, so that we close the cavity that we have created by removing the lump, and the patient is able to maintain her breast mold as much as possible.
Okay, thank you very much, Dr. Ilam. We really appreciate these insights. Possibly you can share with us what are some of the challenges that patients have been having when it comes to issues of breast cancer, issues for screening, according to the experience that you have, and also in your work. What are the challenges that we have been having as breast surgeons, which have not made it so easy to do your work?
Well, I think well, the challenges are many, especially in our setup, in the African continent that we are in. So of course finance is a big challenge. Most of these women come from communities where they can't afford even transport money to come to the hospital, let alone a surgery. So I think that's a big challenge. So I mean, if there are ways we can support them financially, that will help a lot. But a bigger challenge than that, I think, is to, the awareness. Because we feel like if a lady has a lump in her breast, she assumes it's going to be cancer. And unfortunately, most of these women are women who are not so educated about breast cancer itself. So they kind of get scared and they don't want to approach a hospital anymore, because they think that if they go to the hospital, they'll be told they have cancer and that's the end of their life. So they stay with the lump at home, and the lump keeps growing bigger and bigger, and eventually it will force them to come to the hospital. But unfortunately, when they come, then the the tumor has ulcerated, it has involved the muscles, it has involved the skin, and it has spread to the rest of the body. So then there isn't much we can do. Whereas if she came when the lump was small, when she felt it, there's so much we can do. It's something that can be treated. And I think that's, like the takeaway message that I would like to give to everyone, that breast cancer can be treated most of the times. It's not like before where we couldn't treat breast cancer. It is very treatable. So I think, we should not stay at home with these lumps in our breast. We should really go approach a hospital and get help from the right hospital. Again, I mean, if you're going to local hospital and with a lump that is paining you, that looks suspicious, that is growing, and all the time they're sending you back home with painkillers and not doing much, and if you feel that you're concerned about that lump, then please approach a more bigger facility where you can get help. Don't just sit at home with that lump while it's growing on you.
Thank you very much. We are doing very well. We have seen some of the challenges that we are facing as doctors. Patients presenting very late in the process of the disease. Possibly just an interjection is I would want to put forward is that when we are talking about screening, we are trying to look at, I would want to say this, that not every breast lump that a lady has in her breast is cancer. There are many other growth that can be in the breast, and they are not cancerous. And if you come to the health facility and you are assured that it is not cancer, then you have peace of mind.
Exactly.
And if it is cancerous and it is detected early, then you have an opportunity to have it removed on time, and you save yourself the agony of going through the processes of very extensive surgeries, chemotherapy, radiotherapy, which can be time consuming and also overwhelming. Dr. Ilan, possibly you can also help us. Now we have a new health system that is being rolled in our country, the social health insurance.
Yes.
So what would you feel should be done as a way of helping our ladies to access breast care as we roll out this new health system? What would be your advice to the policymakers as they roll out this system?
So I think what we need to do is to make, of course, the treatment for breast cancer part of the SHA that is coming up, so that chemo drugs are covered for, surgeries are covered for, if the patient needs radiation, it is covered for, because really what will stop these patients from undergoing treatment is the cost of the medication. Some of the drugs are not very cheap, especially the chemo drugs, they are not very cheap. And another thing that maybe we should do is avail those treatments in more hospitals, because when we have limited radiotherapy machines in just a few main hospitals, then access for patients becomes very difficult. The queues in our hospitals are sometimes so long that by the time the patient gets to the treatment chance, the tumor has already spread, and that's very sad, because now that's a patient who came earlier to us, but now we delayed her treatment. So I think we need to make the treatment for breast cancer more accessible to the patients by helping them cover the cost.
Okay, thank you very much, Dr. Ilam. We are coming. What would be the key messages that you said to our viewers about breast cancer and also breast health in general?
So I think most of it we've talked about them, but just to summarize is to tell people that breast cancer, really there are a lot of modifiable risk factors to it. I mean, the way we say it, lifestyle modification, what we eat matters, whether we exercise or not matters, whether we are excessive alcohol intakers, that matters, if smoking is a risk factor, so if we can control the cigarette smoking that we have, that will help a lot. And then if a woman has a lump at home, please, the way Dr. Njeri to say, don't sit at home with it. Don't think you have a tumor that cannot be treated. It could just be a benign thing. So many times we see benign lumps in the breast. By benign, I mean they're not cancerous. But just come to the hospital so that we can check it. And if it's not cancerous, then at least you know that it's not cancerous. And if it's cancerous and it's a small lump, you've come to the hospital in good time, we will be able to treat it, because breast cancer is treatable most of the times if caught early.
So there you have it. You have heard it from Dr. Ilam, who is a specialist in breast health, and he has also specialized in breast oncology and surgery. And the key message is that there are simple things that we can do within our capacity. One of them that he has stressed is that self-breast examination. And this is something that any lady can do at the comfort of her home, and you just spend those 5 minutes in a month to check your breast and become your breast aware. So for more information on how to go about doing self-breast examination, you can check our previous videos on the same. Thank you for watching. For more content, please subscribe. There are also the phone numbers which are available for wellness health services, and also the number for Dr. Ilam will be available for more information. I also urge ladies who have gone through some of these procedures, who have been doing self-breast examination, please share your experiences, the challenges that you have, what you can be helped with, and what can we do better as health providers so that we can be able to fight this menace of breast cancer. Thank you very much, and keep watching for more content from our Wellness Health Services videos.